Hello, everyone. Good afternoon, and thank you for coming on board for a wonderful journey to uncover the mystery of healing. We have a distinguished guest who will take us to understanding this territory of healing. It is my pleasure to welcome Dr. Rediger on behalf of Life in Yoga Institute. Dr. Jeffrey Rediger is on a faculty at the Harvard Medical School. He is the director of McLean Southeast Adult Psychiatry. He is on board. He is a board certified psychiatrist and holds a master's degree in divinity from Princeton Theological Seminary. Dr. Rediger has received numerous awards related to patients' care, and he has been featured on radio and television on Oprah and Dr. Oz's show. This book is about his extensive research on healings of the people whose disease were labeled as incurable by modern medicine, as we know today. There are a couple of quotes from this book that shifts focus from physician to the patient, and here they are. 1. If you want to heal thyself or yourself, ask yourself if you are willing to give up the things that made you sick. And the other one is, remember that if you don't take charge of your healing, someone else will, and you probably won't like the outcome. So here is Dr. Jeffrey Rediger.
Thank you, everybody. It's really nice to be with you today. I'm very honored to be here. And over the years, as I've listened to these people with such remarkable recoveries, I've become convinced that the East has been studying the mind and how people heal for thousands of years. And yoga is one of the preeminent sciences around that. And certainly the West needs the East and the East needs the West. And I don't think that we can help people heal until we really understand that at a deep level. So let's get started. Why don't we advance to the next slide? I've been studying people with medical evidence for recovery from incurable illnesses for 17 years since 2003. And so I've had 3 criteria in this. I'll tell you a little bit how this research got started. Shortly after I graduated from residency at Harvard and was a new medical director and faculty member, a nurse from Mass General Hospital in Boston came to me and said that she had just been diagnosed with pancreatic cancer and wanted help explaining this diagnosis to her son, which I did. So we did that, and then she went to a healing center and began calling me saying that she was seeing some amazing recoveries and she wanted me to look into it. I said no. I was skeptical. I didn't think anything was likely to be going on. But Nikki was persistent. She began having people call me from around the country and elsewhere saying that they had medical evidence for their recoveries and did I want to see the evidence. I said no again, but is that I did begin looking into this eventually. And I had 3 criteria for my research. I told people that I really would not be interested in listening to the stories unless they had a genuinely incurable illness according to all that we currently understand. Number 2, I said they had to have medically indisputable evidence for accurate diagnosis and clear evidence for recovery. And number 3, I said there couldn't be any other good explanation for the recovery, such as an experimental medication or anything else. So those were the criteria I followed, and it's been a life-changing journey for me personally and professionally in the 17 years since then. So let's advance to the next slide.
We're not able to see the slides yet.
Okay.
Srijit, are you sharing the screen?
The slide. And Krishna Jhaveri, please mute yourself. Please mute yourself.
Okay, now we can see the slides.
Okay, perfect.
1 second.
Okay.
Right, I think.
Perfect. That's perfect. Okay, so what I've learned is that there's nothing spontaneous about spontaneous remission. If you're on the science side, you call these kinds of events spontaneous remission, and you're taught in med school that these are flukes with no medical or scientific value. If you are on the spiritual or religious side, you call these events miracles or spiritual healing. It's my contention that all of these terms are black boxes that we've never unpacked with the tools of science. Every individual that I studied has made a significant shift in their life, in lifestyle or in perception or both. And the truth is, no one has asked what they did. And so it's fascinating to me that over the years, when a patient has such a remarkable recovery and they tell their doctor, the best that happens is that doctors will say, well, whatever you're doing, keep doing it because it's working. But they're not curious, which is a fascinating statement about how we are socialized in medicine to not see or inquire about what's going on here. Common sense suggests that we should study ultimate performers in health. We study ultimate achievement in business and in sports. And it just makes sense that we study this in health as well. I feel very privileged to be a part of helping to chart an uncharted wilderness. I think there's a lot of possibilities here for all of us in terms of understanding health and well-being. Let's move to the next slide, please. So here's the outline of what we're going to do today. We are going to cover briefly the current state of Western medicine, particularly in regards to chronic illnesses, which are the major killer. I'm a medical director at a psychiatric hospital and the chief of behavioral medicine at a large urban medical center. So I see both illnesses with the mind and the body here. And it's my belief, and I think it's a true statement, that Western medicine is wonderful and life-saving for acute injuries and illnesses, but it's more limited and even destructive when it comes to the management of the chronic or the lifestyle illnesses, which characterize most of medical care. Nearly 1 in 2 Americans, or 45%, has a chronic condition such as heart disease, cancer, diabetes, arthritis, and asthma. These rates are similar in many industrial countries, and I think as the Western diet is adopted in more places, this begins to become the case in many countries as well. Conditions such as these have created an international healthcare crisis and are crippling our healthcare systems. Okay, let's move to the next slide, please. More than 2/3 of all deaths are caused by 1 or more of 5 chronic diseases: heart disease, cancer, stroke, chronic obstructive pulmonary disease, and diabetes. These top global causes of death and disability account for 75% of healthcare spending, and the increased prevalence of chronic disease has caused 2/3 of the increase in healthcare spending. And these rates are going up, unfortunately, around the world. In addition, the World Health Organization has named depression as the #1 health problem around the world. Next slide, please. So the way I characterize Western medicine is, I say that Western medicine is a long line of ambulances at the bottom of a tall cliff. And Western medicine is brilliant at picking up people who have fallen off the cliff and taking them to the hospital or the clinic. But what we're not good at is preventing people from falling off the cliff in the first place. We don't put guardrails up so that people don't fall off. And the people I study did fall off the cliff, but they found a way to climb back up to the top. And the factors we're going to talk about today are what they did to become healthy again. And it's my belief that if many of us did just a fraction of what these people did, we would see a dramatic change in our healthcare system. What's true is that the things that these people did to climb up the cliff are also the things that keep people from falling off in the first place. And so these are factors of health and well-being that are really important, I believe. And Western medicine has been very poor at standing back and looking at the forest for the trees and looking at the transdiagnostic factors that help people develop real health and well-being. So let's move to the next slide. In the West, we tend to focus on parts rather than the whole. A psychological problem is sent to the therapist, a medical problem is sent to the physician, a spiritual problem is sent to the priest, rabbi, minister, or imam. But all of these experts, their advice and skill is really important, but if they don't also do the second step of standing back to look at the whole picture, at this person who's in front of them, what the interaction of all of these different dimensions are in their lives, then we miss the vital opportunities for helping people not only recover, but develop a deep sense of well-being. I have had people tell me that God lost me in a crowd when I was born, and that says volumes about their approach to their life and their illness, and how little motivation they're going to feel to get better when they feel that lost or abandoned in the world. I had a patient with atrial fibrillation recently that is a good example of the ways in which these different dimensions in our lives interact. She was a 64-year-old woman, came into the emergency room with chest pain. She was admitted for a cardiac workup. They didn't find anything wrong cardiologically, and so they had her see me, thinking that maybe she'd had a panic attack. So I sat down and did what I often do. I asked if there's been any stress recently, and she broke down immediately and said that the day before, her husband had announced that he was leaving and moving to Florida. Now, she was a 64-year-old Catholic woman. She had been with him since age 15. She had never even dated another man, and had never lived alone, had never spent the night alone. And so he had left, and then that night was her first night alone in the home in her whole life, and she panicked. I told her I was very worried about her. I wanted her to get some helps and really have the kind of help to deal with this kind of massive stress. She said, "I'm an old school Catholic. I don't believe in that sort of thing." She went home, and then a month later, she was back in the emergency room with chest pain. And this time she was diagnosed with atrial fibrillation. Now, I can't prove that the stress of losing her life and her marriage, as she understood it, caused the atrial fibrillation. But I'm telling you, I see this kind of stuff all the time. There's a woman I see in the hospital who is often admitted after having an argument with her mother. She'll be admitted with thrombophlebitis, and I'll just ask her, "Have you had another fight with your mother?" And those kinds of things. I see these kinds of interactions between mind and body and a deeper part of ourselves all the time. And I believe these are interactions that are the key to helping people regain their life and vitality, but we need to work with the whole picture. Let's move to the next slide, please. So let's move on from that slide. Our time's a little bit limited today, and this is if we can. So basically, I believe that the disease model was a distinct step forward during the industrial age. It enabled the rational identification and classification of diseases, and it lessened shame. It made it more difficult for a person to be told that their illness is a judgment from God or the result of sin. And so I think the stepping in of scientists, these early scientists, to say that these are diseases with a biological cause was a distinct step forward. But it has been an era of disease and medications. And I'm sorry to say that as physicians, we typically don't study how people heal. And so it's a very different set of questions with this era as it was set up for the early scientists to set up a taxonomy of disease and ask questions that began to distinguish the signs and symptoms of one illness and from the signs and symptoms of another illness, and help us develop a whole classification system of diseases. That's a very good step forward, but that's a different set of questions than asking how people heal. Now that we are at the end of this era of disease and medications, we have the opportunity to open up a new era where we actually study how people heal, and we begin to study vitality and well-being and the interaction of these different aspects of our being and see the person behind these illnesses. It's an exciting time to be working in this area and have the opportunity to help us begin focusing on health and well-being. I believe that we help a person with alcoholism or diabetes more, not just by telling them they need to give up the unhealthy lifestyle behaviors, but by helping them realize that they matter and that there's a place for them in the world that only they can fill, and that if we can help them find that understanding of their value and begin begin developing from there, then it's much easier to give up the unhealthy behavior, whether that's alcohol or diabetes or whatever, because then you're more motivated to do so when you understand your value. And I think that's a really different place to come from. Okay, go to the next slide. So I believe that we have been evolving now for a long time in the direction of models that are increasingly less deficit-based. For far too long, especially in the West, religion has often been thought of as a sense where people are sinful creatures primarily. In the West, we have overemphasized original sin, and we have not built our theologies on the image of God enough. And that's one of the reasons why I tell patients all the time that they need to spend some time, if they are interested in understanding their value. Yoga, the Eastern writings, Buddhism, Hinduism are deeply structured around the goodness and the value of each individual. And it's a really important understanding for helping people heal. So religion needs to be founded on the divinity and goodness of each individual, and not on original sin or the sinfulness of individuals in a primary way. Psychology problems are often reduced to deficits from childhood instead of understanding the largeness of the human soul and psyche, or even the immortality of the soul. Psychiatry, human problems of living are regularly reduced to neurochemical defects, and that is also in a deficit-based understanding. And in medicine, the disease model redefines disease rather than the strengths, capacities, and well-being of the individual. And so doctors are taught to actually eliminate the story of the individual in order to penetrate through to the underlying signs and symptoms of disease in that person. And it's the story of the person, the story of what's going on for them currently in their life, and even in the overarching teleology of their life, that really provides the clues to what's going to be helpful in healing for them. Okay, so let's move to the next slide. So I'm really interested in a model that allows us to build on what's right with a person. And as we just talked, any theology that emphasizes original sin over the image of God limits the capacity of the person to heal, I believe. And let's move on to the next slide. Deficit models in psychology and psychiatry reduce conflicts to deficits from childhood or neurochemical defects. They assume that the deficits and defects reflect something real about the person. And in my experience, even a really good therapist, if they are still thinking about what's wrong with this person more than what's right with this person, that creates a treatment resistance, and the person might not even be able to put into words why they're resisting the treatment, but it's really important that we see people for what's right and possible about them. Next slide, please. So as we mentioned, deficit models in Western medicine focus on disease rather than on what heals. We need approaches that cultivate what's right, good, and possible within an individual. We need to focus not just on the discrete disease states. We need to also look at the deeper roots of many illnesses and the opportunities that healings represents. Let's move on to the next slide, please. So we have two worldviews. If you look at the ancient spiritualities, both East and West, and it's really the Eastern writings that helped me see this, and then I found this buried in the Western writings as well, but they are more neglected in the West, unfortunately. So in the ancient spiritualities, you find that at a deep level, the person or the soul is perfect, whole and complete. They already possess all that's needed. And it's not that the person is flawed or that they need external knowledge or technology in order to heal. They are asleep and need help awakening. The disease model does approach things as if the person is flawed and they need an external knowledge or technology, something external to them, before they're going to be able to be healed. So the treatment is external. Let's move to the next slide, please. So in these ancient spiritualities, divinity is within, both immanent and beyond. The emphasis is on connection and wholeness. Illness begins in the soul, and the whole is greater than the sum of the parts. That's a really helpful approach to have next to or also as part of Western treatment. In Western thinking, the divinity is external or non-existent. The emphasis is on individual expression. Illness begins in the body, and emphasis is on the parts and on the individual. Next slide, please. So, again, ancient spiritualities, you have this underlying perfection where the person already is all that they want to be and all that they long to become. It's all within the person and just needs help awakening. The soul, there's a part of the soul that stands outside of space and time and is considered to be immortal and indestructible. Its power is understood as power with others, and the invisible world is thought to be more real than the visible world that you can see and touch. And that's found in the teachings like Maya and that sort of thing. And that's, we could talk a lot about that. In Western thought, original sin often is historically taught as primary. It emphasizes this life, and there's a lot of value to that. But the person is thought to be destructible. Power in the West has historically been imagined as power over others rather than power with others. And the visible world is considered primary, the world that you can see and touch. We could talk a lot about the differences in these worldviews. Let's go on to the next slide, please. So the evolution of culture has been a slow movement away from negative and deficit-based models toward a positive vision of the underlying goodness and latent capacities of each human being. I think that's really what history is about. If you trace through the development of language, when I was in seminary, I was very interested in seeing how over time human beings began to separate mind from body and psyche from soul and individual from community, and develop more and more distinctions and understand all these different sides that we have. I believe that democracy, human rights, self-help, and the movement towards strength-based approaches are all this movement in history towards a more positive understanding of who we are, of who each individual is, and the capacities within each person. So the future is about an increasing reliance and trust in the individual's capacities for self-knowledge and self-determination that is less dependent on experts, hospitals, labs, and is more focused on the individual's needs and aspirations. So we're really talking about the democratization of medicine over time. So next slide, please. It's an exciting time with all of these changes coming. Our smartphones are really going to be the help us become the CEOs of our own health in many ways. You know, Martin Luther back in, if you trace through the major shifts in culture over time, you see that technology often helped these big ideas of democratization. Technology helped that happen. Martin Luther in the Reformation could not have been a part of the Reformation in the way he was unless there had also been, as there was, the printing press and the folios. So our smartphones, internet, apps are all going to continue pushing this evolution. The sensors and the environment will help that as well. And it's just a matter of time until medicine is reshaped around each individual instead of around the doctors, the experts, the hospitals and the labs, etc. So the next slide, let's see that please. So let me tell you, let's move on to the next slide from here, please. So Saint Peregrine is the patron saint of cancer and illness. He is historically a priest who was afflicted with cancer of the tibia. He had a trance-like sleep and had a deeply spiritual experience, and he awakened in the morning and the cancer was gone. So he's often called the patron saint of spontaneous remission even. The cancer never returned reportedly. He died many years later of unrelated causes. So the question is, what shifted inside him? So let me go through, this slide deck seems to be a little bit different than the one I had planned on using. Let's move to the next slide, please. So there's a lot of different people we could talk about. I tell most of these stories in Cured, the book. The one I want to focus on, and do we have slides next of, let's go to the next slide. Okay, so I want to talk to you about Juniper Stein. I don't know if her picture is in the slide deck. So she worked with okay, so it looks like that slide got taken out. Okay, so let me tell you about Juniper. She was a woman who used yoga a great deal in her recovery. She was a young, successful accountant managing millions of dollars for her company. And she went through a 2-year process of difficult pain. And at the end of the 2 years, she was diagnosed with ankylosing spondylitis, which is a really difficult, incurable illness where your bones calcify, starting in the pelvis, and the calcification just creeps up your spine until you really become an immovable concrete mass in a lot of ways. You just can't move, and eventually you can't even expand your ribs for breathing normally, which of course is a devastating thing. So she diagnosed with ankylosing spondylitis. She told her doctor that she accepted the diagnosis, but she absolutely did not accept the prognosis. She was determined to find a way around this. She was in love with her husband. She wanted to have children. She wanted to have a life. She was a young woman. They gave her a set of exercises to do. She said, "These are for old women. This is not for me." And so she went to yoga. And this was 40 years ago. So yoga was not a very common treatment at the time or common approach. And yoga became the doorway into a completely different life for her. She then began to change her nutritional level based upon what helped her feel better in yoga. She eliminated most meat. She eliminated all processed foods. She eliminated actually mostly animal products for the most part. She made a few exceptions sometimes. She also began to realize in yoga that she needed to fundamentally change her relationship with stress. And that became an overall important pathway for her as well. She changed a few jobs. She then began working with her husband in the starting of a company together, which gave her more control over her environment. And then in the context of that, went on and raised 3 children. Now, she, in the context of her pursuit with this, she began to use yoga to push through the pain. She took pain medications for a short while, and they initially were helpful because they allowed her to just kind of relax and breathe a little bit. And that was a first step that was important, I believe. But then she began to realize that these medicines were cutting her off from her body. And when she was in the yoga, she didn't feel she can go as deeply into the poses as she needed to do. So she ended up eliminating the medications and then really trying to find a path through this. She had a fascinating cathartic experience at some point through all of this. And she had a memory one day of being 10 or 12 years old, Thanksgiving Day, at the home of the relatives. And someone said to her, when her cousin walked through the room, her cousin was about the same age as Juniper, and someone said to Juniper, they said, "Your cousin is swinging her hips way too much for a girl her age. I hope that you're going to be a good girl when you get older." And Juniper said that this memory, many years later, and having a cathartic experience around that, somehow, she said, helped begin freeing something up in her. And so we've got several things going on here. She changed her nutrition completely. She learned how to manage her stress very differently and began to look for ways to get out of chronic fight, flight, or freeze, and to look for ways to challenge her stress in ways that were for her, but not with stress so high that it's causing her to decompensate. And then also this psychological piece where she ended up really changing and healing her identity and her beliefs, where she ended up having a really different understanding of who she is as a human being, much less deficit-based, and she began to see herself much more compassionately, and she felt liberated to be more who she was as a person, as a woman, and otherwise. And so there's a lot we could say about a story like this, but it's a really important story about what healing entails. So Claire is a good example of the nutrition, the first pillar of healing and well-being, nutrition. She was diagnosed by biopsy with pancreatic adenocarcinoma in 2008. She also, like Juniper, eliminated most processed foods and chemicals, sugars, enriched flours, and animal products. It's fascinating to me in the path of researching for this book, as I was writing about these stories. Over 100 years ago, at least in the West, the average person consumed about 2 to 4 pounds of sugar per year. We now consume, on average in the West, about 152 or 154 pounds of sugar per year. And of course, we have a biology that just is not equipped for that. And so I think we need to understand that what we put into our body really does play a role in the creation of some of these lifestyle diseases. 88% of the survivors converted to a vegetarian diet. Not all of them did. I purposely tell the story in Cured about a few people who did not go vegetarian, and they still experienced an incredible healing. But by and large, they converted to a vegetarian diet. And as part of that, they also eliminated processed foods and a lot of the sugars and refined grains. And I think it's important to understand what that means. There's a lot to understand in that kind of nutritional change. I went vegetarian in med school and was not very smart about it. And I was still eating a lot of sugar and refined flours. And I don't think that was good for my health at all. So I think there's a lot to understand in that kind of change. And again, I'm not completely against animal products, but I think we consume so many animal products in the West, and the animals themselves have often been so stressed because of the way they've been treated, and so they've been flooded with stress hormones, and there's so many issues around all of that. I think it's worth understanding better. I think it's important that when a person does make nutritional changes, that they don't make the nutritional changes from a place of fear or from a place of what they are losing in terms of foods that they used to like or do like. I think it's easier to make these kinds of changes from a place of opportunity and from seeing it as a way of putting nutrition into your body rather than focusing on what you are giving up. Next slide, please. Thank you. The second pillar for healing is healing your immune system. One of the things I've learned over time, and what the research is showing, and what will eventually penetrate Western medicine more deeply in daily practice, I think, is that when a person gets ill, they typically don't have a diabetes problem, an autoimmune problem, a cancer problem, a heart problem, or a high blood pressure problem. More fundamentally, the person has a chronic inflammation problem. And if you want to lower the amount of inflammation in your body, then you need to heal your immune system. So that's a really big topic. Inflammation in the body is basically an immune system that's gone awry. This is all really relevant right now with this pandemic that's going on. It's been quite a thing for me to watch how this pandemic is unrolling. Louis Pasteur is the father of the germ theory, and it was a brilliant step forward when he was able to prove that illnesses are related to the microbes in the person's body. And he showed that definitively. He showed that diseases are caused by microbes, by bacteria, by viruses, and by other particles that can cause disease. But the way in which we have appropriated the germ theory, I think, raises some questions and bears discussion. For the rest of his life, he was in intense debate with Claude Bernard and a few other colleagues who said, no, it's not that simple. Bacteria cannot invade a healthy body, or neither can viruses. And this is all relevant for the coronavirus as well. So microbes, whether it's a bacteria or a virus, cannot invade a healthy body. We are surrounded at all times by microbes, by viruses and bacteria that are inside of us and outside of us. They only can create disease if something breaks down in our body. And so they are more the symptoms of breakdown rather than the cause of the breakdown. The way this debate took place back in the day of Louis Pasteur was that Claude Bernard was arguing that if you take care of the terrain of your body, you will not get ill. He, in front of his classroom at one point, drank a glass of cholera in order to make his point, and he did not get ill. So he really believed that if you know how to create a healthy, balanced body, bacteria and viruses cannot become invaders. On his deathbed, Louis Pasteur, after years of fighting against Claude Bernard and a few other colleagues, he was dying, and he said that Bernard was right, the terrain is everything. This is what he reported. This is according to the son-in-law who was writing a memoir about Louis Pasteur at the time. It looks like there's some pretty good evidence that this was actually said. It's been corroborated in several different ways. Okay, next slide, please. So the microbiome is what was called the terrain by Claude Bernard, but what this is the language we use now is the microbiome, and it's a really important area of investigation. Hippocrates said all disease begins in the gut. So we have a vast ecosystem of beneficial microbes that includes bacteria, fungi, viruses, parasites, bacteriophages, and I think it's important to understand that for the last 70 plus years, actually more than that, we have been doing a lot of things that actually weaken the immune system rather than create strong and vital immune systems. And we do that with antipyretics to get rid of fevers that are not dangerous. We do that with immune suppressants that suppress the immune system. It was actually a case of spontaneous remission that started Dr. Steven Rosenberg at NIH on the path to developing what is now a new and exciting approach, which is to begin using the immune system and finding approaches that make the immune system stronger. And we're seeing that as a growing approach now in cancer care, and it has a very good future, I think. But that was started with a whole case of spontaneous remission around stomach cancer, and if we had more time, I'd go into it. But it was an important case that got Steven Rosenberg started on that. Next slide, please. So the microbiome, small intestine, 22 feet long, it's an inch in diameter. It's like a plate of spaghetti in the center of your body, has thousands of villi, like shag carpet for absorbing nutrients, and it's the home of your immune system. 80% of your immune system is in your gut. And so if you take care of your gut, then you have a way and a pathway to developing a much stronger and vital immune system. The large intestine, 5 feet long, 4 inches wide, it hosts the largest microbiome in your body with all kinds of microbes, bacteria, bacteriophages, viruses, etc. Next slide, please. So the truth is we are more bacteria than human. We have 100 trillion microbes, good, bad, neutral, 100,000 different species, 10 times more microbes in our gut than cells in our bodies. The human genome is 23,000 genes. The microbiome is 8 million genes. Human DNA is 1% of our total DNA. 99% of our total DNA is microbial and modifiable. And it's like having an additional hard drive. And so basically, we have a limited amount of information that we can carry in our own genes, and we have this whole massive other system inside of us. And if we wipe it out with too many medications, with too many courses of antibiotics, for example, that are indiscriminately used, we are really weakening our immune system. And so I'm not against antibiotics. I mean, I prescribe them, but I try to be really judicious about it and only use it in situations that are really necessary for the person. When possible, I think that we should be doing the kinds of things that preserve and buffer our microbiome. I came across an interesting study in the course of writing the book that women who have had a number of courses of antibiotics have an increased risk of breast cancer. And it's not just that, the study showed that it's not just that if you've taken antibiotics, you increase your breast cancer risk. It's a dose-dependent relationship. And so the more times a person has had antibiotics, the more risk for breast cancer. So I'm not trying to say anything against antibiotics except to be smart with them. I think that we need our microbiomes. We need to work with overwhelming infections that we can't find a way to beat without, but I think there's so much to do to create strong vital immune systems that we don't do. So next slide, please. So the real issue underlying most diseases is inflammation, and so I think eventually as this research gets into the hospitals and the clinics, doctors will start asking questions to help patients lower the amount of inflammation in their body rather than just thinking cholesterol is the problem, etc. Many treatments in different specialties treat symptoms rather than causes, whether it's cholesterol, high blood pressure, dementia, depression, anxiety, arthritis, cancer, etc. And so decreasing inflammation is an important pathway for healing our immune systems. Illnesses are the smoke, inflammation is the fire. Treat the cause, get rid of inflammation. And one way to do that, of course, is with anti-inflammatory foods and changing one's relationship with stress. Now, let me go quickly through, because we are at 45 minutes now and I want to leave time for questions. Let me go through the last two pillars. We've touched on these a little bit, but the third pillar is healing one's relationship with stress. And I just want to say briefly that some stress is good. Challenge stress is important for us. We all need challenge stress to help us grow and learn. Running a marathon, for example, can be challenge stress if it helps you reach into your higher self and expand your understanding of what you're capable of. But if you are in a toxic relationship, or if you finish work every day depleted, run down and questioning your value and worth, then something needs to change because you're going to be in chronic fight, flight, or freeze, and you're not going to be able to heal properly. In that kind of situation, you need to get the kind of help that helps you either change your environment or change your relationship with your environment. So that's the third pillar. The fourth pillar is healing your identity. And that really is about healing the deep beliefs within you. We all grow up in certain families. We grow up with listening to kids on the playground, and we interpret the statements that are made in our families or on the playgrounds in certain ways. And this continues as we grow older, go into high school and college, etc. And a lot of these beliefs that we inherit, some of them are positive and some of them are disempowering and false. And they together in composite form our identity. They help us shape an understanding of our value in the world and of who we really are. And these beliefs are, for the most part, unexamined. And so some of them are true and some of them are false. I have come to believe, as a result of studying these people for so many years, that if you have a set of beliefs that are partially true and partially false, you will be giving your life and your body mixed messages, and it will be more difficult to heal. So I think there's a lot to be said for examining one's beliefs and strengthening the ones that are true and eliminating the ones that are false. And that's a really big topic, but I have found it to be really important. One of the most common things that people have said to me over the years is that if you, what they've said is that it took an illness for them to wake up and realize that they needed to stop taking care of everyone else. They needed to stop responding to the perceived expectations of others and instead focus on what creates life and well-being within them. And people will often tell me that they initially felt selfish in changing their life to begin focusing on their own health and well-being. But I'm telling you, it's not selfish. It's beginning to value oneself and one's purpose at a whole different level, and it creates a completely different kind of relationship with oneself and with others that turns out to be really important for the recovery of health. I've learned that if any of us can die to an old version of ourselves in such a way that a new, truer expression of who we really are can be born, that sometimes we don't need to die physically yet. And the stories that I have had the privilege of studying have been life-changing for me to see what it takes to change one's beliefs, to heal one's identity. I can't tell you how many people I've studied who they've changed their names sometimes. They have told me stories of walking down the street in Idaho where they had lived their entire lives and people not recognizing them anymore because they have become such a different person. These stories are powerful and inspiring, and they have inspired deep changes in my own life as well. come from an Amish background, from a very violent and difficult childhood and a world I was living in, and I rebelled and left all of that and went to college in my later teen years. And then on my path through seminary, where I really tried to understand what's true and began changing my beliefs. And then I went to medical school and then residency in psychiatry, and then began studying these individuals. These individuals have brought about such a deep change in the way I view who we are as human beings in the universe. It's brought about a deep change in how I understand my role and the role and the possibilities for all of us. And so I have found these stories to be really important. I'm going to wrap up now because I know that we need to leave some time for questions. And I think there's a process for doing that.
Thank you, Dr. Rediger. It has been exciting talk. And I have been gone through the book, but I tell you what, there are so many examples and so much details in it. It is very hard to put everything together in such a short time.
Yeah.
Understand that. And my initial question was that, which you answered already, that how did you come about writing this book? And the immune system is the way to go. And one has to find what is their immune system is, right?
Yeah, right.
So how does that immune system work? What is it comprised of, for the lay person? Like, I'm a doctor, so I understand that. There are other people who don't know what is the immune system. So could you please, in shorts, in 5 minutes or so, if you can.
Yes.
Is it some kind of a medicine that we take it? Or is it the particles in your body that moving around? They call it immunoglobulins.
Yeah, good question.
Are the cells that produce this one?
Right.
And you have the ability to talk to the cells or produce the cells by yoga, meditation, or whatever. You have the control over it. The third question is the mind. Is it your mind that is sending those signals, or is it your brain that is sending the signal, or is it the soul, which is the whole thing? So
Great
there are
question.
so many things that are involved in it. So could you elaborate a little bit on it? Thank you.
Yes. So we all have this this amazing immune system with all these brilliant cells and cell subtypes. They want to do their job crisply and efficiently, but for that to occur, we need to give them the proper conditions. And I think we need a lot more research to show the possibilities of what happens when we do that, when we eliminate toxins, when we don't over-medicate, when we spend time with people we love who make us laugh, when we flush our lymphatic system regularly with lots of water, when we get plenty of rest. These kinds of things fire up the immune system. And I think there's just so many of the toxins that we put into our bodies and the ways in which we relate to stress. So what we know is that if your body is in chronic fight, flight, or freeze mode, you are going to be bathing the cells of your immune system with the stress hormones, cortisol, norepinephrine, etc. And we know that those stress hormones, if they are chronically secreted, they will numb the cells of your brilliant immune cells, and they will behave sluggishly, and they will behave incorrectly. And so that's, I think, and that's relevant for all of the diseases, including autoimmune diseases. And so a different relationship with stress is really important. When you activate the vagus nerve, which is the parasympathetic pathway, and it is the opposite of chronic fight, flight, or freeze, you bathe all of your immune cells in a very different physiology and create a different chemical environment. You are releasing, when you smile, it's the vagus nerves that causes you to smile. And when you make eye contact, or when your eyes sparkle, when you make contact with somebody visually, that is the vagus nerve. And that smiling, that effort to make contact with another person and communicate love and affection, whether it's your partner, whether it's a child, one of your children, or if it is the person that you see on the street that you pass, or the bank teller, or the person at the grocery store, when you make genuine eye contact and smile and just communicate positive energy to that person, you light up a physiology in your body that is good for your immune system. Oxytocin is released. That's the love molecule. Serotonin is the happy molecule that is associated with less depression and less anxiety, for example. Dopamine is the pleasure pathway. These chemicals, among others, create a very different physiology, and your immune system loves being bathed in them. So that's a partial answer. The other question you asked about what is it that brings about healing? Is it the brain? Is it the mind? Is it the soul? I think that that's a great, deep question. I think that the mind has an influence over the lower centers, which are biological, that is still unmapped in the West, but the East has been studying for thousands of years. And I think the fact that some of the people I studied did not make any nutritional changes, but they made deep changes in their beliefs and identity. They healed their understanding of their value and their purpose and their understanding of the universe, whether it's a friendly universe or not. And those kinds of changes sometimes can be so deep that that making the dietary changes actually become less important. So I think that there's this a larger influence that can come from the deeper aspects of the mind when we begin to understand that at a deeper level. Ultimately, the soul. Now, what is the soul? That's a big question, of course. I do believe the soul is immortal. I do believe that the physical body is a metaphor or expression of something that the deeper self or the soul is trying to understand. And so I think that adds more questions when a person has an illness, that if they are interested in doing so, it can sometimes be liberating to ask, what is it that their soul is trying to learn? Because when we learn those things, it often does have an effect on our body that can be salutary and healing.
So relevant to this is this, you talked about the vagus nerves and the parasympathetic,
Yes.
that we don't have a control over it, right? So now I believe the meditations has some influence on relaxation mode,
Yes.
exciting the parasympathetic. Could you elaborate on it, how that works in meditation? Because we, in Eastern culture, meditation is the key. It is called medication, it is the medication for your mind, So how do we take that medicine of meditation? And
that's a good question. Let me start here, and then if I'm not capturing your question quite correctly, reframe it for me.
Sure.
So meditation, I think, is something that needs a lot more study. I think in the early years when the meditation studies were being done, they were doing this on college students who did not have much experience with meditation. It's a very different thing to study an advanced meditator. And so we know now, with the later studies that have been done, that people who have spent years going deeper into the mind and the deeper mind, and even beyond the mind and brain into a deeper self, that they do experience a physiological change that can be caught on PET scans, for example, and shows that their physiology is different. And so I think you're raising a couple of issues. Relaxation is very important. Relaxation is activated by the vagus nerve. I think that's part of the story. Learning how to relax and get out of chronic fight, flight, or stress is a learned skill. It's not something that just happens. You have to learn how, I think all of us have to learn how to get out of the physiology of chronic tension. But it's also about love too. It's not just relaxation, and that's a complex discussion physiologically, but love. We've talked sometimes about the loving kindness meditation, for example, which is about imagining at deeper and deeper levels what it's like to feel unconditionally loved and what it's like to feel unconditional love for others. And so in the loving kindness meditation, and some of the variations of that, a person practices feeling unconditional love for oneself, unconditional love for a family member, unconditional love for someone with whom one is having conflict, and learning how to experience that self, whether it's oneself or others, with a different physiology. And it's a very powerful approach, I think, to healing not only conflicts, but also healing our physiology.
Thank you. I didn't see any more questions on the chat box, Sriji.
I have one question.
Yes, go ahead.
This is Tanuha. So I'm a yoga therapist. Have you used yoga therapy as a way to evoke the parasympathetic response, balance the vagus nerve responses, and improve the immunity in the process? Have you had any experience with that?
Yes, I have. It's been mostly something that's come up in the research that I do, that people will tell me of incredible stories they've had because of this. There was a woman sitting in my office recently who, she started telling me her history. She'd been raised in been raised by a mother who abused heroin, and she had been sexually abused as a child, and awful things had happened to her. And she was there, not as a patient, but for a family meeting because her daughter was hospitalized. And so telling me about her she had been divorced twice, had been raped a number of times, had used heroin herself, and had just a really traumatic life. And so 12 years prior to, but I said to her, I said, this is clearly not who you are. I mean, you could just tell. This is just, hearing the story, I was going, what is this story? This is just not who the person is who's talking to me. And she said, well, 12 years ago, she began taking her health more seriously. So she started going to psychotherapy. She had done psychotherapy before, but she had never taken it seriously. And as part of that, she began taking better care of herself. And then she went into yoga. And she began to use yoga as a doorway, much like Juniper Stein did. And she was in yoga one day, and I forget the pose she was in. I think it was child's pose. She had an inbreaking realization that she had misunderstood the entire story of her life, that she was not who she thought she was at all, that she was not this screwed up individual, this person who, no matter what she did, was never going to be good enough. And she had this experience, a deep experience, that she was fine as she was, that she really was okay. And this was a life-changing realization for her. She went out after that and began changing her life and integrating this new understanding of who she is into her life. And ever since then, her life has just gone from one success to another. She has had a very steady career now and has been very successful. The man who was sitting next to her during the family meeting adores her. They've been married now for 10 years. And it's a very positive relationship. And she traces it all back to that day in yoga where she realized that she really wasn't who she thought she was. And so she said to her daughter, she said, you've got to go into yoga, and I want you to get into this pose, and I want you to really let this go to a deep place in you. And so that was a story that I do tell in the book because it was really helpful to me in terms of understanding how much something like yoga and how critical it is that we end up with a different experience of who we are in terms of how our healing comes about.
Dr. Jeff, excellent talk, very nice. I have a question. I'm a surgeon, a lot of cancer patients too. I have a question, Jeff, is about this spontaneous regression, what we talk about. And I was looking back in the history, Dr. William Coley in 1891, he devised one cancer drug and cured a lot of cancers. He's from the nature. Now, you being the both allopathic and holistic spiritual expert in this field, is there any way you can or we can find out which would go into the spontaneous regression, any kind of cancer if we know? Any kind of immune modulations or anything?
Ask you a question again. What's your question?
So the question is about this spontaneous regression of some of the cancers.
Yes.
And you said it is because of the immune response.
Yes.
So looking at this, can we just find out, is there any research going on to find out which kind of cancer would go in a spontaneous regression? Any kind of a research study or anything here?
Great question. There's a lot more research that needs to go on. We do know that some cancers are more susceptible to spontaneous regression than others. For example, for some reason, renal cell carcinoma more commonly goes into spontaneous remission for reasons that we don't know. And so some are more susceptible, some are not. As you know better than I, that every cancer is unique in terms of its pathophysiology and in terms of its natural course. Some cancers wax and wane, some go away very quickly, some are recalcitrant but are very susceptible to treatment, some are very susceptible to surgery, some are not, some are more susceptible to radiation. So every cancer has to be understood on its own terms. But it's also true when it comes to spontaneous remission. Some cancers are more susceptible to spontaneous remission, and we just don't know what those factors are yet. We do need a lot more research on this area.
Perhaps in the lines of what Dr. Rediger just spoke about, perhaps we can ask Mr. Ramesh Bhutada to share his experience of his spontaneous healing. Perhaps that, and you could respond to that, Dr. Rediger. Is that okay?
I would love to hear it.
Yeah, go ahead.
Ramesh, it's all yours. Unmute yourself.
Yeah, I am Ramesh Bhutada. I live in Houston. I'm 74 years old. And I was suffering with chronic fatigue syndrome since the age of 35. When even the chronic fatigue syndrome name was not even coined.
Of course.
Yeah, and it really started in about 1981. It was pretty severe. And at times, for days together, I couldn't get up from the bed. Sometimes I wouldn't be even able to hold a spoon in my hand to have a meal. I would even feel like that if someone is calling on the phone, why in the world they're calling?
Yeah.
No, it's like I didn't have the energy to speak.
Yeah.
That's the condition I lived through for 35 years till the age of 70 when I met Dr. Rajan Narayan. In Houston, he had come here for a CME course. And he started with me a gentle Ujjayi. It helped me initially, but then again it came to a point where it wouldn't help any further. And then he started with me a chakra meditation. And that was really a game changer. And I held through that process going through. That chronic fatigue did not want to leave me.
Yeah.
It really fought hard, to leave my body. And I felt that it was a result of, some of us may or may not believe, but it was the result of some of my past life's karmas. That is what caused the chronic fatigue. So eventually I found out there was only a spiritual solution to it. There couldn't have been any other solution. For all these 35 years, fortunately, I was well placed financially. I had a business, I had a good family, very good family support from my wife, from my friends, from my colleagues at the office and the business, that I survived through all this. And I went through all different types of treatment. I didn't really pursue a whole lot of allopathy. When one doctor told me, my doctor friend, Ramesh, we don't know what causes it, chronic fatigue, much less we know how to. So just forget about allopathy, you do anything else you want to do. So anyway, I tried Ayurveda, I tried acupuncture, I tried Chinese energy healing, I tried acupressure, homeopathy, everything I tried, multiple times with multiple experts over these 35 years. And then fortunately, through this chakra meditation, and later on, I found out that the chronic fatigue had really caused problems to all my organs. Like 35 years of chronic fatigue caused my gut system problems. My heart became weaker. I had 2 heart attacks. My spine became a problem. I had a spine surgery. And then Dr. Rajan used the subtler mantra therapies, just reciting mantras internally like a japa. And that has really cured me all the way through. And I got to tell you this recent experience, if you'll allow me for another minute or so, that for last few days, for about a month, I was having excruciating pain in my calf muscles, behind my knees, behind my thighs, lower back, and behind my neck. And then eventually I called Rajanji and asked him. And through his meditation and intuition, he figured out what the cause was. And he asked me to do Ujjayi. It helped to a point. Again, then I said, it is not helping anymore. And then he said, there's another reason behind it, which was very psychological and emotional, that I had a conflict with someone very close to me. And that conflict has created a problem in my inner being. And that was getting reflected in my symptom. So he gave me a very emotional way of dealing with it. He said, you meditate with this mantra home, but when you meditate, visualize that you are hugging your grandchild. You know? So I started doing that. I did that meditation this morning for 2 hours, you know. And he said, you do it for 3 hours and it will go away. I did it for 2 hours, and believe it or not, all that pain which I was having, it has gone down by about 60–70%.
Wow, that is a beautiful story, and I so appreciate you sharing that. It's a heartwarming story, and it explains so well just some of the factors we're talking about here. I do believe that our illnesses have these roots in deeper parts of our psyches and our souls, and when we can liberate that and let that that part of us be healed, it has such an effect on our bodies. And you know, hats off to you, because being diagnosed or carrying a diagnosis like that back in the 80s, I'm sure it was not diagnosed properly or correctly for a long time, and I'm sure it was a very isolating and misunderstood diagnosis for a long time. It still is, but boy, 30 or 40 years ago, it was much more misunderstood and not treated in any way correctly, even though it's a very difficult illness to bear. So thank you for telling us that beautiful story.
Dr. Rediger, I must tell you, listening to you, I felt 80% of the time I was speaking to myself.
Yes.
You know, so much of what you said, I have gone through and experienced in my life.
Yes, I bet. That's how this path works, is because I think that's why it's so important that we map this area, which the East has been mapping for a long time. And there's so many insights in these traditions that we need to make better use of.
Let's make this as a movement, and I'll be willing to support any way I can.
Well, thank you for telling your story, and for just, your story is important for all of us, and it just shows the power of this stuff. It's never really about the illness. It's about something else. And that when we can, that's why every single person I've studied in retrospect has been so grateful for their illness, because they said that they have such a different understanding of who they are now and of what the world, the universe is like, and that gives so much well-being and happiness, just having that truer understanding. And so these illnesses are for us, they're not against us. It's not really about the illness. It's a beautiful story.
No, it is what you said is, we start, rather than starting from deficit, start from strength.
Yes, exactly. That's right. Because we all have something so special and magnificent inside of us, and to experience the dignity and the value of who we are, that in itself can be life-changing.
Let me introduce Dr. Sarkar to Dr. Rediger. Dr. Sarkar is a cardiothoracic surgeon, vascular surgeon, heart surgeon, and he himself had you had an open bypass surgery, right, Dr. Sarkar?
20 years now.
20 years. Now, what happened, you know, as your book, and I was going through and I was thinking about Dr. Sarkar, that something happened to his mind, you know, and he went out of his mind and he left his job, he left his practice, and he thought he has to take a different route. He listened to the inner, you know, soul and science that came up, and he took up the yoga. And he's the yoga master, and he has a big, you know, thing behind his name. You know, now that the MD, FACP doesn't make any sense to him anymore. So, Dr. Sarkar, would you please tell him what you're doing? And
okay, I'll take out very few moments. Dr. Rediger, I know about you very well. And this is my book. It's called Yoga Therapy, Ayurveda, and Western Medicine. And the time is called A Healthy Convergence.
Oh, wow.
And it's a convergence of the three modalities here. And then if you look at, there's a picture of Albert Einstein and called Rabindranath Tagore. And Albert Einstein represents a science, Tagore represents a philosophy, called where a science meets a philosophy.
That sounds
First
fascinating.
of all, okay, I thought Rajan might already give you my story because Rajan has my story better than even myself, you know. So I will give you I'll give you a couple of, I'll take a couple of minutes. I'll show you a few slides. I have a tremendous number of patients who have been improved with we call it a daily routine called dinacharya and yoga therapy. And finally, what we come up with, it's a relaxation response. It's an activation of the parasympathetic tone. It acts through your limbic system. Rajan knows all about it. Me and Rajan, we talk about it. It's an amygdalian hippocampus. One responds to fear, one to memory. It sends a signal to your hypothalamus, sends a signal to your pituitary, through pituitary adrenal axis. It's called a psychoneuroendocrinology, psychoneuroimmunology. And then what it does, it corrects altered hormonal homeostasis, and it creates a more parasympathetic tone, and it suppresses your sympathetic tone, your stress. What happens when you have a food intake, the whole gastrointestinal tract, starting from your parotid gland up to your anal sphincter, is supplied by parasympathetic nerve.
Yes.
So when you get food properly digested, as me and Bipin also knows and Rajan knows, we are what we digest, not what we eat. Right. So if you see when you create that parasympathetic activation, the food becomes part of our body. Food is not an energy. We call it a saptadhatu, 7 tissues. You know, Sanskrit, there are many people here knows Rashadhatu, Raktadhatu, Mamshadhatu, Metodhatu, Ostidhatu, Majjadhatu, Shukradhatu. And that is 7 tissues formed and form a substance called ojas. If you don't have the parasympathetic activation, this food converts into your high cholesterol, high fat, high sugar. People who are on a high parasympathetic activation, their cholesterol level comes down, sugar comes down, every level comes down. Now, do I have the permission to share my screen? Can I show you at least 4 or 5 patients, just pictures? All of you
I'd
can
love
see?
to see that.
Yeah,
okay, let me share with you first. I think I should have it. Okay.
There it is.
There you go. Okay. Can you? Okay, this is that is me. If you don't have my story, as Bipin and Rajan was saying, about almost 19 years back, 2001, I had a sudden heart attack, had a significant triple vessel disease, and I had emergency triple vessel coronary artery bypass. At that time, I have no so-called risk factors. My blood pressure is 120/80, blood sugar is 80, cholesterol is 160, no truncal obesity. Couldn't find a cause what caused my heart disease.
Wow.
So we got
incredible.
Okay, we got a percentile thallium scan at the time, myocardial perfusion scan. I had a large still defect on the left side because my circumflex was not properly perfused. I was placed on aspirin, statin, beta blocker, ACE inhibitor, and I met a yoga practitioner, Ayurvedic practitioner. I think Rajan has met him. Name is called Vijay Stalling. He showed me this, we call it a very grounding poses, called a sthiram sukham asanam, stillness, happiness, grounding asanas. I did it every single day instead of, in addition to my medication, I started doing it.
Mm-hmm.
Dr. Rediger, I have all of your, I read about all about you. Okay, Jeffrey is good. You call me Dilip, I call you Jeffrey,
Oh, yeah.
in the same profession. So I'm getting, every year, I'm getting my myocardial perfusion scan. And this is your myocardial perfusion scan to see your blood supply to your heart muscles.
And what an incredible story.
Third year, it started almost. There is proper perfusion. By fourth year, the whole myocardium getting perfused properly. There is no sign of any ischemia. But that time, I started negotiating with my doctors. And by fifth year, slowly and slowly, I withdraw my medication. Plus 15 years, I have not touched a single medication. And I'm drug-free over 14 years now. But I do every single morning. I do a lot of things. I do get up in the morning. I drink a glass of water. I call it sit down. I had a proper elimination. I do a tongue scraping. I do a jalneti, Then I do every morning 1 hour, 25 minutes of asanas, 25 minutes pranayamas, 10 minutes meditation. And Bipin was telling me that what happened, I also somehow, felt that parasympathetic activation, saliva in my mouth all the time.
Yeah.
Okay. Just to show you a couple of other patients, if you don't mind. These are
what a great story this is. I mean, what I love about this is you have all of the data, both from before and after, and that's why this is such an important story. Your ejection fraction was only 10 to 20%, so that means...
this is not mine. This is another one I'm going to show. Another patient.
All right.
No, my ejection fraction was okay, but I had a large, reversible ischemia. And I'm in the same town for the last 45 years. Every physician knows me in this town. I was in the faculty called Eastern Virginia Medical School. I was a cardiovascular surgeon. So in fact, in my class, I have a large number of physicians who comes to my class. Guess what they come for? They come for failure of their pharmaceutical support.
Yeah.
They have all the complications for the support, they come. This man, Alan, comes to me around 2013, about 7 years back, with 10 to 20% ejection fraction. He had a significant coronary artery disease. He had a 6th admission of congestive heart failure in 1 year. He had angiogram done. He had an inoperable coronary disease. He came to see me. I just started very gently. I met the person who was there. I let him sit down in a chair, do a very, very mild, like you call a Gano Mudra, do a little breathing. Exhalation is parasympathetic. Inhalation is sympathetic. Exhalation longer than inhalation, and I tell them to go home and practice. So if you see it here, after around 6 months, he comes and he's doing this. He's doing a bakasana to the crow. He's doing a half plow. And this is the lady. She also has a multiple sclerosis. No, she has a Parkinson's disease. I let her sit down like in a very right angle posture. Already by the time she sits like that, a relaxation response sets in and goes away. So when I saw Alan doing this, I said, Alan, you need to go to see your cardiologist. He goes to cardiologist 6 months, and ejection fraction is 40%.
Wow.
What is based on is a profound sympathetic overdrive with a reduction in the afterload and with a premium increase in the preload. You as a physician understand the increase in the preload, reduction in the afterload, so there is an increase in the ejection fraction.
Yeah,
which is
so
possible for. Go ahead.
Yeah, can I explain for the those who are listening what the ejection fraction is, just so they understand? This is a really important story. So this individual, initially, when he started seeing you, he had ischemic cardiomyopathy with an ejection fraction of 10 to 20%, which means that his left ventricle of the heart, which is the ventricle that pumps blood to the rest of the body, with each pump of the heart, only 10 to 20% of the blood was leaving that chamber and being pumped to the rest of the heart. And so within just 6 months of yoga practice and with this path that you set him on, within 6 months, his ejection fraction had improved to 40%, which is incredible, which means that with each pump of the heart, 40% of the blood was now being pumped out of the chamber to the rest of the body, which of course means the body is going to be much better perfused with oxygen. and the tissues are going to be perfused much better. A normal ejection fraction is around 65%. So when a person has a normal ejection fraction, their body pumps out, with each pump of the heart, about 65% of the blood to the rest of the body. And so 40% is a massive improvement. I'm sorry to interrupt. Go ahead with your story.
That sounds great, but look at the next phase. I'm doing a headstand. People knows, Rajan knows very well. I do a headstand not as a active, passive. I said, you put your head down, and what you look for, your baroreceptor sensitivity. What is baroreceptor sensitivity? When you put a head down, pressure inside the head goes high up, pressure inside the eyes goes up, pressure inside the carotid artery goes up. But if you keep your head down, slowly and slowly homeostasis comes in. Your pressure comes down, all the intraocular pressure comes down, then you start breathing better. It's called annamaya kosha to pranomaya kosha. Any imbalance you create in your physical body, it shows up in your breath. So slowly and slowly, by the time it happens, you develop a phenomena called neuroplasticity. Like your brain gets a signal, that's the way I can be. Slowly and slowly, body will go high up. So he said, Alan says, I'm going to try. And here, Alan comes to my class and try. But Jeffrey, take a look at this. You are the only one who will understand. Now he has, this is your 2014 in August and your 2015 in March. He's off medication. His total cholesterol came down to 142. HDL went up to 64. LDL went up to 65. Triglyceride up to 64. Wow. This is the figures like you're a teenager. He's 75 now. He's off medication. This is what I was saying, the proper digestion of the food by parasympathetic activation and relaxation.
That's fascinating. Yeah, that's great data.
Look at another data. Okay, I'll show another cardiac. Well, let me show another cardiac so you'll understand the cardiac data. This fellow, he has the cardiac events that he would have been dead by now. He had an open heart surgery in 69, had a malignant hypertension, 1989, surgery for the descending thoracic aneurysm, atrial fibrillation, congestive heart failure, pacemaker. And he comes to me, I said, start slowly. Essentially what he find out, Robert, is that these balancing poses, and he does mudra, which quiets down the mind, and look at what happened, his total blood count.
Wow. Those are great numbers.
Total 145, age of 50, and this is off medication now.
Wow,
and
with
he
that
learned
kind of
about
cardiac history, that's incredible.
See, they do the three things. First, the reduction of the pharmaceutical support, better quality of life. And he just turned 81 now. He still comes to my class. Every single guy, he's the first one, he does like this. He said, yeah, look at that. This is about, he was 77 by the time he's learning the balancing poses. Why? Because it affected him so well. And if you go back here, look at this lady. She had a multiple sclerosis. She was in a wheelchair. She came with a multiple medical problem. When she started my program, within few months, and she was on a medication for asthma for 20 years. In a few months, it is gone. With yoga, she got a less leg weakness, improvement of balance in 4 months, medication for multiple sclerosis stopped. And then she came on, she said, come on, I will show you a license plate. License plate. I said, what does that mean? She said, I'm transforming. I told her, yoga is the art of transformation. She comes to my class.
Great story. I mean, these are incredible stories. I love that you collect all this data too.
Yeah, I have tons and tons of this. This fellow has a Parkinson's disease. He comes, he even practices. These are called a tripos, Brickhashen. And I said, let me hold. He said, no, you don't have to hold. But first thing he tells me that when I have a Parkinson's disease, in Ayurveda, we call it a vata disorder. And he get a very stiffness in the back pain and irregular bowel movement. Nobody could explain. Neurologist says, this is your neurological problem. What does it have to do with the bowel movement? But first thing he said, it improved his balance, posture, stiffness. One thing I noticed on him, that he never lost his tremor in his hand. His hand has a tremor like this. He has lost everything else. Parkinson is like a stiffness.
Yes.
Relaxation. Finally, he says, I'm going to learn a headstand. Look at that. He's doing a headstand.
Really?
When he does a headstand, look at he's doing a headstand.
Right.
Look at his age. What is age? We talk about contraindication for headstand. Contraindication, listening to your body's signal. No pain, effortlessly, slowly progression in stages. He tells me when he is in a headstand, the tremor is no longer there.
Really?
Yes. And the neurologists, they know me very well. They said, go ahead, go to his class, keep doing it. This lady, she's already in charge of our Parkinson's disease. Look at the lady with the Parkinson's disease, the pose she's doing. Almost impossible for a Parkinson's.
That's incredible.
She's 65. She had a Parkinson's since she was 48.
Wow.
We did 3 years of yoga therapy, strengthening her weakness of the muscles, no tremor, good gait. This is another fascinating fellow, This guy, he does a headstand. He owns is a community yoga center. It's called Psychiatric Space, where I go. He had a cataract surgery done. This is a physician, you will understand this.
Yeah.
His eye surgeon also does yoga. And eye surgeon's wife is a yoga teacher. And he has been doing, first thing, a ophthalmologist say, if I do a cataract surgery, don't do a headstand. He did 6 weeks. He says, you've been doing it all of your life. I didn't do anything. I just put the two lenses. I just put the two lenses inside your eye. 6 weeks post cataract surgery.
Wow.
Doing a headstand.
That's fantastic.
So if you see, patients of this lady, she's an accountant. And then what I see, when she came to my class, she had a stroke, she had intracerebral hemorrhage, weakness of the both lower extremities, and she came with a raggedy clothes. She doesn't even sit down properly. Finally, Cecilia, why don't you sit down straight? She sit down straight. Look at the transformation. When you feel good, what happens? One day I see, now Cecilia comes, she's having a yoga outfit. Now a nice pants, nice shirt. Next day she comes, she had a little lipstick on, she had her hair done. Finally one day came, she had this colorful clothing on her body. Look at the poses she's doing.
Wow.
She said, when I feel good, I dress good, I look good.
Yeah, right. Start studying them. These are great stories, and your evidence is fabulous.
Right.
Can we give Devji, Devendra Mahajan is over here, a little bit of a chance to share his experience also? And we will conclude with this thought of how to get the medical community involved in the last 5 minutes.
I'm Dev Mahajan, 84-year-old now, about 33.
You look like 48.
I had open heart surgery where 2 of my arteries were found blocked 95% and other 2 70%. Over the years, 3 times stents were added to keep me going. 2 years back, during a checkup, I was told that probably there is no room to add more stents. It was my good luck that right at that time, Mr. Ramesh Bhuttadaji told my wife, who's a physician, in casual conversation during a social gathering, that how Dr. Rajan Narayanan has helped him to overcome his problem of chronic fatigue syndrome, as well as some other serious heart-related issues. Within few days of that conversation, Dr. Rajan Narayanan happened to visit Houston. I got examined by him through his BioWell techniques and was told to do 2 practices. 5 minutes of breathing through my throat called Ujjayi Pranayama yama, and 20 minutes of meditation with Im mantra, both time, morning and evening. At the time of my examination, I was facing these three big issues: hiccups or belching, more so at night. Could hardly walk 4 or 5 minutes without pain under my arms, and weight gain due to water retention. After doing these practices for about 7-8 weeks, my hiccups were gone and a slight improvement in my walking. To make my story short, within 4 months, I could walk 45 minutes to an hour and my weight started improving. Along with that, during that time, I stopped baclofen for my hiccups, torsemide for water reduction, and Hyzar for blood pressure, and an Autor inhaler for my breathing. For me, it is a life-changing experience, and I'm very happy to share my experience to anybody who's willing to listen for a couple of minutes. Thank you for giving me this opportunity to share my story, and God bless Dr. Rajan Narayan. Thank you.
What a fabulous story.
Now, Rajanji, it's on you now.
What I can do is I can give you a yoga perspective. The part is, you see, Dr. Sarkar, whom you heard, a lot of the aspects is about the physical yoga elements, which he has in a very ingenious way, how he has utilized it for different purposes for different patients to get out of it. What we do is, yoga that is popularly seen is called Hatha Yoga. That is more oriented towards physical. And the purpose of Hatha Yoga is to cleanse the physical communication system. The yogic system looks upon the body as not a biochemical communicating system, but rather an electromagnetic communicating system. And so what happens is the physical element helps in that communication, and the physical approach to it, the way they say in the yoga language, is you're cleansing the channels of communication. So in the yogic way, they say there are 3 levels in which we operate. One level is at the physical level, the second level is at the vibration level, and the third level is at the spirit level. And so they call it as the physical body, the vibration or subtle body, and the causal body, which is the spirit. So, so what happens is there are 3 essential approaches to yoga, and all of them are part of one yogic system. One is the approach to physical cleansing of the communication channels. The second is the vibrational cleansing of the communication channels. And the third is what you would call as the mental or the spiritual element, the mental cleansing of the channels. So in these 3 approaches that are done, if you integrate them all together, that is the real yoga. And that is what the text of yoga called the Yoga Sutra speaks to, the integrated approach to using all of them together. And when we integrate them all together, many of the things that Dr. Jeffrey Rediger mentioned, they all fall in a systematic way. You mentioned, of course, the key issue when you said in the 4 pillars, your last pillar was healing your identity. And in that, when you called about healing your identity, there you mentioned about taking care of yourself. But then later on, when you were addressing Bipin Solanki's question about the role of the soul or the spirit or the inner being, you mentioned about being in sync with your purpose in life.
Yeah.
And so if you look at it in terms of taking yourself and being in sync with your purpose of life, this from a yogic philosophy perspective is being true to your soul purpose for which you have come into this body. And the word that is used in yoga is called swadharma, your dharma, the purpose, what you're there for which you have come into the body.
Mhm.
And that is the key. In fact, when you laid the pillars, actually, from a yogic point, it is bottom up, from the fourth to the third to the second to the first. So when you're in sync with the soul purpose, what happens is you manage your stress better. And what is the meaning of managing stress better? Managing your stress better means there's the yogic concept that we all have a little transmitter within us. And that little transmitter, if you can call it our wireless modem, when we're in deep sleep, we automatically, unconsciously connect into it. And in deep sleep, we get, as I like to say, we get our daily dose of antivirus and program updates that soups up the immune system. And of course, from a research and physiological perspective, it is very well known that deep sleep strengthens the immune system. And in fact, in the studies on immunology that have been done, there are two sides to immunology. One side is the innate the immune system, which is the memories which are there in the immune cells. And the second is the adaptive immunity. And the adaptive immunity, while we more often relate to what happens when we get a vaccine shot, how the adaptive immunity builds within yourself, it is associated with deep sleep. Now, and the same thing is the case with the idea of meditation. When we learn to, there's something that you mentioned, when you learn to smile, when you're open, that concept of being open is you're opening your wireless modem, you're opening your transmitter connection. When you're in stress, you close it down. And so that is the source of how we understand the immune system. So from your fourth pillar of healing the identity to managing stress, the being true to your soul purpose is healing your identity. And the managing stress is opening up and letting your wireless modem communicate. And so that strengthens the immune system, your second pillar. And when you're in sync with all of that, you know what you should be eating and how you should be working with your environment. So this is how the yogic process fits into this sync. Now, this actually goes into the two other very interesting things that you mentioned, and then I will twist to the to real conventional research that can be applied. The part that you mentioned about the lady Juniper, how the medications were inhibiting her healing, right? So she had to stop her medication in order to heal herself. So this is something we come across all the time. But on the other hand, we have no authority to give directions on prescription medication. So we always tell people that be aware this could be the care thing, and consult with your physician and to see how you can gradually reduce your dosage of medication. So that is a very important element, and medications interfere with the immune system.
Yes,
and,
they do.
And of course, the ones which are immunosuppressants are directly impacted, others a little more indirectly. And the other element, Dr. Kiran Parekh asked the question about why you were mentioning about renal cells from a cancer healing perspective. Renal cells are more receptive to healing. You mentioned that, right?
Mm.
And there is a reason for that. But we understand simply when people are on ARBs or ACE inhibitors, we are really working with the stress factor, how it is impacting the renal system. Mm. And so what is happening for us is the moment you begin to de-stress, you're releasing the renal cells, the hold on of the cancer on the renal cells. So deep relaxation is that is the quickest place you're going to see the reversal.
That's fascinating.
Yes. And so now, when we look in terms of how all of these can be studied objectively, and I want to bring in over here what Ramesh Bhutada said. He's one of the very big philanthropists in the Houston area. And he supports so many philanthropic projects, some 100 organizations he supports every year. So he was mentioning that to take this forward, he'll be happy to support in the scientific this thing. What has happened is I'll show you three items for you to think about. First thing is, what is the scientific basis to even think about that there is a electromagnetic communication in the body?
Right.
Now, the first thing that happened is, going in 2004, there was the first publication by a gentleman called Kwan Subso, who is a biophysicist from Seoul National University, who did his PhD from Brown University in Rhode Island and went back to
school.
University. And he published the first paper on these colorless tubules that are there in the body that look like normal tissues. And he identified, for the 21st century, a new anatomical body part that has never been heard before. And today, there are well over a few 300, 400 publications in PubMed. And if you do a search on primovascular system, it will give you the linkage to all of them. Wow. I'm going to actually pop up for you right over here.
Primal vascular system, you said, right?
Primal vascular system, exactly. So
P-R-I-M-A-L.
Primovascular, yes. And so I'm going to throw up over here one of the screens here where you can see. Okay, this is a very recent article, and you can read the last line over here. The primovascular system, go down all the way, the primovascular system has been referred as possible anatomic support for conclusion of information during an acupuncture treatment, which could be connected to biophoton transmission. Okay?
Wow.
And what we do is, now I'm going to stop sharing that. And now, how do we measure the biophoton transmission? Right here, this is the machine you can see in my hand. This is a camera, which is where there is a little plate here, and there is a round iron piece over there. And the moment I click it, the voltage of electricity goes, and it creates an electromagnetic field. And your fingers, one at a time, we measure it. And from that measurement, we are able to see what is the functionality of some 40 different organ systems in the body.
Wow.
We can gauge the functionality. And what does the functionality look like? What does the 40 different organ systems look like? I will show you right on the screen over here. Oh, I see we are running out of time. So I'm going to throw it up over here, and I'll quickly close it out. Literally, this is how it looks like, and I will show you all the organ systems that we are looking at over here. You can see over here in the head systems, it looks at all the organs in the head. The cardiovascular system, you can see all that, the details it's looking at, the endocrine systems, the spine, the central nervous system, the digestive system, the urinary system, and the nervous system. Actually, this nervous system is the peripheral nervous system, and the spine represents the musculoskeletal, the central nervous system, and the immune system over here. So since we are running out of time, I'm going to kind of quickly conclude over here that this method of analysis enabled us to find how to use this system. And in this using this system, what we were able to do was, we actually published a first paper in 2019. And if you want to look at our paper, you can see it over here. The paper is called Bioenergy and its Implication for Yoga Therapy. So how we have utilized this system. In fact, the full paper is available over there. It is on free, this thing. And how we measure the tables over there, how we have measured it, and all of that, the system is given over there. So
I would love to look at those articles.
Yes. So so in conclusion, what it is all of this is measurable. And what Ramesh Bhutada explained to you, and what Devendra Mahajan explained to you, all of this we were able to capture initially because of the diagnosis. In our approach, what we do is we take 4 sources of input. One is the conventional medical diagnosis. Second is lifestyle elements, sleep, eating habits, work habits, and things like that. The third we look at is we actually do the pulse reading of Ayurveda. Actually, there is a way to express this in Ayurveda. I don't have the time, so I'll skip on that. And the fourth element we look at is this reading, the biophoton reading. And the biophoton reading is what tells us, and the unique thing about the biophoton reading is it instantly changes based upon whatever therapy you use. So what happens is I can try a technique on you and I can instantly validate whether it corrected your biophoton transmission, which means whether it's working or not. And if it is working, I will ask you to do that practice for a period of 6 to 12 weeks when the neuroplasticity will kick in and it will heal the process. Wow. So in a sitting, I can predict whether it will work for you or not. So with that, I will close over here with the one thought over here that Ramesh Bhutada is talking about, that he'll support of this project if we can take this research forward. And this is what he mentioned, that this thing. So with that
is so exciting.
Yes, I will ask you, Jeffrey, to conclude, and Bipin Solanki, and then Ratna to conclude. Please take it away.
Well, I just want to say how exciting and how honored I am to be a part of this. These are really exciting stories. It's certainly true that India has been mapping these pathways to healing and well-being for a long time, and the West and East need each other to really complete a more holistic and more helpful understanding of what is possible and necessary for healing to occur. I want to thank you for sharing these great stories and for these exciting approaches. I think there's so much potential with this, and it's very exciting because I think the West is finally becoming more open to these things. So it's very exciting.
Thank you, Jeffrey.
Thank you. All right, so we are coming to the end of the sessions, and I would like to thank Dr. Jeffrey Rediger. We are very grateful for taking time off your busy schedule, Dr. Rediger. Your book will be a guiding force for those who accept the diagnosis but not the prognosis. Again, thank you, and with everyone here to be well and safe. Thank you.
Hello, thank you all for participating. Please go to lifeinyoga.org to see all the programs we are offering.
Take care.
Bye-bye.